Okay, we'll call the good afternoon, good morning, depending on where you are in the country. For me, it's 1 mid-afternoon. Thank you for joining us today. I'm Representative Jim Dunnigan and appreciate everyone taking some time on their busy schedule. I think it's great to chair NCOIL's first meeting of 2024, and I hope everyone's year is off to a great start. We have only one item on today's agenda. It's an item that's ready for a vote after a year of vigorous and healthy debate. That item is the NCOIL dental loss ratio model, and so let's get started. Before we begin, I must say that I wish chairing all committees was as easy as today's committee where the work's been done. And it was done last year and this month. And so today I have the opportunity to preside over the vote. Seriously, a lot of work has gone into developing this model, and the model underwent significant changes since it was first introduced last year. The latest version of the model was distributed and is posted on the website. Importantly, the latest version is supported by representatives of both sides, as indicated by the joint statement of support from the NADP and the ADA that was distributed and posted. I'll stop there as I don't want to take any more time away from the sponsor of the model, Delegate Westfall. So as a reminder, in addition to being sponsor of the model, he chaired this committee last year, so he deserves a lot of credit for overseeing everything that led us to this point. I want to stop and let Will do a roll call and see what our quorum looks like.
Thank you, Mr. Chairman. I'll start with committee members that have registered for the call. Arkansas Representative Deborah Ferguson. Idaho Representative Rod Furness. Illinois Representative Rita Mayfield.
I'm not seeing
Present.
Will.
I'm here. Mayfield is here.
Thank you, Representative Mayfield. Kentucky Representative Rachel Roberts.
Just a moment.
Michigan Representative Brenda Carter.
Present.
Minnesota Senator Paul Lutke.
Present.
North Carolina Senator Vicky Sawyer.
Hello.
New York Senator Pam Helming.
Here.
New York Assemblywoman Pam Hunter.
Here.
Ohio Senator Bob Hackett.
Here.
Ohio Senator George Lang.
Here.
Oklahoma Representative Ellen Hefner.
Yeah, we could all hear you just fine.
West Virginia Delegate Steve Westfall.
Here.
And we have Chair Dunnigan as Vice Chair, Representative Tammy Nuccio here.
Yes. Here.
Okay. Moving to other legislators that registered, Arkansas Representative Carolyn Brown.
Yeah.
Yeah, but I think that, I mean, that's going to be.
That's Connecticut Representative Jill Berry. Kansas Representative Bill Sutton.
Okay, I'll put this.
Massachusetts Representative David LaBeouf.
And then you could give a thumbs up in the book.
Minnesota Representative Stephanie Young. Missouri Representative Bob Titus. Oklahoma Representative Mark Tedford. West Virginia Delegate Walter Hall.
Here.
All right, are there any other legislators present that I did not call?
Yes, Assemblyman David Weprin from New York.
And
From Idaho.
Senator Daphne Michelson-Janae from Colorado.
Representative Rachel Roberts, Kentucky. Representative Bridget Kozarowski, Pennsylvania.
Representative Kyle Mullins from Pennsylvania.
Okay.
You got Deborah Ferguson, Arkansas.
And did you get
Thank you,
Rod
Representative
Furness, Idaho? Rod Furness, Idaho.
Yes, thank you, Representative Furness. Mr. Chairman, we'll just need a motion to waive the quorum requirement.
All right, thank you. Do we have a,
So moved. Second.
thank you. We have a motion and a second to waive the quorum requirements. So the quorum requirements are waived. Okay, we're going to turn the time now to Delegate Westfall. And after we hear from him, I'll open it up to other interested parties that would like to speak. Delegate Westfall.
Okay, thank you, Mr. Chairman. Thanks everybody for being here. I want to start to thanking everyone for the hard work on this model. It's always great when you have a compromise reach and end results being a good piece of public policy. And I want to stress there's a significant compromise from both sides on this. If you look at the model when we first started and look at where it is now, there's a striking transformation, big difference and stuff. I like to say I've really learned a lot. I mean, a lot about how this process, and I'm glad we're taking some extra time to go further and discuss this issue. Back in November, I was prepared to vote for the prior version of the model, but I was glad I didn't. And now we got the best of both worlds. We have a model I think is superior and will have been discussing and is supported by representatives of both dentists and the dental plans. In terms of substance of the model, we end up with what is being described as the Colorado Plus version. And that means the model doesn't simply require a simple DLR percentage of all the dental plans, rather requires the dental plans report the DLR information to the commissioner, while the commissioner then aggregates for each market segment. The commissioner then calculates an average DLR for each market segment and identifies any outliers as dental plans that fall outside and certain scope of the average DLR. The commissioner then authorized to take enforcement action against the outliers, which includes ordering them to issue rebate. And if the carrier reminds an outlier of 2 consecutive years, the carrier is subject to a minimum DLR percentage as determined by the commissioner via rule. I'll stop here and thank everyone again for this hard work. I'm planning to introduce this version West Virginia and the Banking Insurance Committee next Tuesday morning, if I can get it drafted in time. It is in bill drafting. I hope other states pick up this great piece of legislation and move it forward. For that, thank you, Mr. Chair. I think we lost our chairman.
He was having some audio trouble. I don't know if he disconnected and is reconnecting.
Vice Chair is here, if that helps.
While he's coming back, I really want to thank everyone. It was an honor to chair this committee. I really appreciate
okay, can you hear me, Delegate
Yes.
Westfall?
Yes,
Yes.
Okay.
yes.
Yes.
Thank you.
So it's back to you,
Okay,
Mr.
let's
Chair.
open it up to interested parties. Will, do we have any interested parties?
Yes, we have Owen Urick from NADP with his hand raised.
Okay, go ahead.
Well, thank you, Chair Dunnigan and members of the committee. I'm Owen Urick. I'm the Director of Government Relations for the National Association of Dental Plans. The compromise language in front of you today represents an important step forward in the policy discussion on dental loss ratio issues. And I want to thank Delegate Westfall, the NCOIL staff, the American Dental Association, and the NADP membership for all of their hard work in delivering this language to the committee. In short, as you already heard, this model language would establish a data-driven approach to dental loss ratio regulation, which determines statistical outlier plans and directs insurance commissioners to remediate those plans, which are statistically outside those norms. For plans that are outliers for multiple years, the commissioner will set a loss ratio based on the market average for the outlier dental plans to meet. NADP believes that this represents a practical and thoughtful compromise between plans and providers, which we hope will be considered by state policymakers. Going forward, we hope this is part of a continuing dialogue in dental coverage and oral health, which is constructive towards the mutual goals of improving Americans' oral health. Thank you, and I'm happy to take any questions on the model or otherwise.
Thank you.
Questions? I see some legislators that want to comment. But thank you. Do we have any other
don't see any other interested parties with their hands raised. So, Mr. Chairman, if you'd like to move on to any legislators.
To Representative Tammy Wisniewski.
Go ahead, Representative.
Thank you. So I just want to be sure. I read the model law and looking at it, and I just want to be sure. So we're not actually establishing a DLR. We're establishing a reporting timeline where departments of insurance will calculate what the DLR is and calculate an average of what they're seeing. And then anybody who's outside the average will be given guidelines to come within the average. Is that ultimately what we're saying now?
So there's it's not automatic that they'll automatically come within the average. The commissioner has the authority, Representative, to take enforcement or remedial action, including rebates that would then bring them into the average, but it's not an automatic thing.
So we're really just collecting information at this point. We're not establishing a loss ratio for dental.
Well, something between the two. So it's collecting information and empowering the commissioner to take action if she believes it's warranted or he believes it's warranted.
Okay. All right. Thank you.
Okay. Thank you. I see no further hands raised. Okay. No, we do have one. Rita, go ahead.
Okay, I just had a question because you mentioned rebates. How does that trickle down to the patient?
So on the ACA side, and I'm assuming very risky when you assume, but the rebate goes to the customer. Anyone who's more in the trenches than I am, feel free.
Tom, that's right, and that's the way that the model was written. So the policyholder.
Okay.
Does that answer your question, Rita?
Yes. Yes.
Okay, let's go to, is it Senator Hackett?
Yeah, I just want to thank Steve. Steve is really great work. You know, I was a critic. I wasn't real crazy about the loss ratios, but you developed a solution that we all could support. So great work by the staff of NCOIL. So I'm just pleased as punch they worked something out. That was great.
Thank you, Senator.
Thank you, Senator.
Anyone else? I see none. Will, do you see any?
No, I do not, Mr. Chairman.
Okay, thank you. Hearing no further questions or comments, I'll entertain a motion to adopt the model.
So moved.
Second.
So we have a motion to adopt the model and we have a second. Any discussion? Seeing none, I'll place the vote. All in favor, say aye.
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 Opposed?
Aye.
Opposed, say
Aye.
no. Okay, the motion carries. Thank you. Any other business? I see none. So I'd like to remind everyone that registration for the spring meeting in Nashville is now open. So please be sure to register and book your hotel because the room block will likely sell out. I apologize for the technical difficulties. Fortunately, you can hear me. I can only hear you on my cell phone. So thank you for that. I'll entertain one final motion to adjourn.
Move we adjourn.
Second.
There's a second and a second. We have a motion to adjourn. All in favor, say aye.
Aye.
Both say no. Motion carries. We stand adjourned. We will see you in Nashville. Thank you.
Thanks, everyone. Have a great weekend.
Yes.